If you're just joining us now, we're still waiting for some other members to join us. So we'll commence this webinar at about 5 minutes past the hour. That should give you enough time to grab a cup of tea.
So I have to type fast for all these shout outs, Kylie.
I'm a bit worried about your fingers. I think it might be good for you to start maybe the introduction. Everyone seems to be in good spirits on the chat.
Fine. Okay, so hi everyone. Really great to welcome you to this Wednesday. I'm Scott. I'm the CEO of the Institute of Employability Professionals. Welcome to the IEP webinar series. This is the second in our series of 8 webinars in partnership with the Better Health Generation. Thank you to Kylie and the team, it's brilliant. This week's webinar is on the subject of mental health and social distancing and isolation. Please make sure that you sign up for the rest of the series when the links are published in the IEP Learning Network e-bulletin, which you should get every week. Stay well, stay safe, and get chatting on the chat link. And please remember that this and all the webinars are recorded and are available to you on the IEP YouTube channel. We're really excited about this series. As I say, this is the second one. You're all very welcome, and please use the chat link to tell us what you think. Thank you.
Thank you, Scott. Hi, everyone. My name is Dr. Kylie Henderson. I am the Managing Director for the Better Health Generation across Australia and the UK. We have put together this webinar series, and if you haven't used webinar before, I thought I might firstly quickly orientate you to the webinar process. There is a Q&A box. If you have any questions for me that you'd like to ask during the presentation today, please add them to the Q&A box and we can make sure that we answer those at the end of today's session. There is obviously also chat, and I can see everybody chatting through. I'm going to ask Scott to keep a notice of what's happening on the chat in case anyone adds any questions. The questions can be added through the Q&A as anonymous if you'd like to, or they can be added through the chat. So Scott will be definitely following that and let me know at the end exactly how they're going. Because we do have 350 people registered for today, you are all on mute, but you can pop up your hand at any point, either via the chat or via the controls at the bottom of your screen. So hopefully that's enough of a technical introduction for everybody. Before I get started though, I just want to tell you a little bit about the Better Health Generation so that you're aware of our organisation. Many of you I haven't met before. So it's made up of a number of different brands across both Australia and the UK. We have a division called Aim to Work, which is a health services team helping people to either gain or sustain employment. That could include a health and work assessment, or it could include intervention and follow-up to make sure people stay in work. Me and Work is our corporate services division. So that's a group of psychologists, occupational therapists, physiotherapists, organisational psychologists, all working together to ensure that organisations are psychologically healthy and happy. Your Health Plus is our technology brand, which delivers mental health technology via a digital health platform. Care Squared and Care Squared Kids provides disability services to people in their homes to help them to achieve their goals. Generation Care provides services to people over 65, particularly mental health and health services. We do some assessments in Justice, and Back to Work is our Australian division of health and work and employability in Australia. So that's just a little quick overview about our organisation if you haven't ever met us before. I'm a clinical psychologist and a number of our team are allied health professionals as well. We have also on the line today Natalie Keating, our CEO from the Better Health Generation UK, and Andy Mion, who is our National Partnership Manager. So thank you for listening to me for that first 60 seconds. I want to start by giving you a bit of a reflection over the last 20 years as a psychologist, and it will lead into why I'm presenting today. When I first registered as a psychologist in 1997, the statistics at the time were that 1 in 5 people would have a mental health condition at some stage of their lives. More recently, the statistics in 2019 in the UK grew to 1 in 4. 1 in 4 of us will have a mental health condition at some stage of our lives. It's quite alarming to me that in the last 20 years, those statistics have significantly risen. What's also really alarming to me is that we know that 1 in 2 unemployed people, or 1 in 2 people not working in 2019 will have a mental health condition. I'm really concerned, and it brings me to why I'm presenting today. I'm concerned about what will happen in 2020. We know the economic state of Australia and the UK is changing. What will mental health be like in 2020? I'm particularly concerned because I know how much the UK government spent last year on mental health services. They spent $12 billion on trying to improve those numbers that you see on your screen today. Unfortunately, that amount of money isn't changing. So my call today is a call of action to everybody that's on this webinar to say that we all need to work together to improve the mental health of the UK community as a group. But in order to do that, we all need to be healthy first. We cannot be mentally unhealthy ourselves and help our clients as effectively unless we use our own strategies and our own advice first. So this presentation is about you. It's about making sure that you have all the resources in place to manage this new time, and I'm calling it a new time because any other connotation might suggest that it's negative, and I want today to be about how do we turn something that might be uncertain into a positive and an opportunity for us to become the best version of ourselves. So this is about you. I know if you are healthier, I know that when you're working with your clients, either via telephone, video, or how that might be at the moment, or how that might be in the future, I know if you're healthier, you'll be able to help more. And together, we'll be able to have a more significant impact on the numbers that you see on your screen today. With that said, I thought I might quickly recap for those of you who weren't on the webinar last week. I'll just quickly recap the strategies we discussed last week in order to thrive and build your resilience. So we discussed time management, we discussed helpful thinking, being reasonable about the media content that you're consuming, increasing your connectedness. We talked a bit about values and we also talked about enjoyment. If you were on the line last week, I also challenged you to develop your own thrive and coping plan and to look at these factors to see what you needed to do last week. This week, I want to talk about another model, which is the Rise Up model. Again, I'm talking about how do we turn these circumstances into a more positive opportunity for you to rise up and for you to rise above some of the distress and some of the anxiety that is within our communities at the moment. So let's talk about these 4 factors. Let's talk about routine. Many of us are outside of our routine at the moment. Some people I'm talking to feel like they're on holidays. And when you're on holidays, you generally consume more food, more alcohol, and stay up later, sleep less. So there's a range of things that are outside of our routine at the moment. What I'm suggesting is that in order to be mentally healthy at the moment, we need to stick to a structured routine. And we need to try to make sure that that routine is as normal as our normal everyday lives might be. I've included this to-do list here as a bit of a template for you to consider implementing at home. It's got down one side the schedule for the day. It's got the things that you must do or your to-do list, which you need to check off. There's also an opportunity for a workout plan because we know that 30 minutes of exercise per day is helpful for our overall well-being. I've included an eating plan as well, and also some notes there where you could add in some enjoyable activities. Again, this is a strategy that you could be using to help to improve your mental health during this time. Not surprisingly, we also need to be adjusting our family routines. Not too dissimilar to the model and template that I showed you before, this is a model for helping children to optimize their brain capacity or to optimize their learning capacity. It includes all of the factors that I was just talking about. However, there's a little bit more in here for children around focusing time and making sure that there is some time for children to reflect and also some time to I guess consolidate the activities and events of the day. Again, it's a strategy that we would use with helping young people to perform better, but again, it's a strategy that we all could be using at this time. So if we look back over routine and setting our own routines, we can be adding in all of those factors that are on this healthy mind platter that would help us to optimize our performance during this time. The I in the Rise Up is, how do I improve myself? What are the things that I could do right now during this time to be the best version of myself? I'm challenging you to think about micro skills, to think about things that you could do to help you with your career in the future. There's a fabulous website, edx.org, that offers you all of the micro skills that you could learn for free on the one website. These are university courses, including Harvard. There's some fantastic courses on there that are all free for you to be learning. And again, they're short courses or there's longer courses. There's a theme going on in leadership at the moment around micro-credentialing, and this is a great opportunity for you to improve yourself in a time where you've probably got a little bit more time to do these things, and you may not have that time when you're in the busy rush of day-to-day work. What about creative activities? There are also other opportunities you could access to practice these skills that you may not have had time for in the past. Learning a new language, and I've included a website there, a fantastic free website that teaches you a range of different languages and prompts you to learn those languages every day. Working towards your fitness goals. The NHS has produced a fantastic strength and flex exercise plan. It's a 4-week plan that you can do within your own 4 walls. You don't need to go outside, where you can build your strengths and flexibility. It's a great opportunity to set that plan up in place. There's videos, fantastic. And again, around mindfulness and relaxation, some free resources there for you to improve yourself. So overall, if we're going to improve ourselves, we need to challenge ourselves intellectually, we need to challenge ourselves psychologically, and here's a range of opportunities that you could be turning into the better version of you. We spoke last week about values. I think values are really important, and if you had the opportunity to think about your values last week, you might have also thought about some behaviours that you could be doing during this time to help to demonstrate those values. If you really value kindness, if kindness is one of your top 3 values, what have you done in the last week, or what could you do in the next week to really demonstrate that? That might be kindness towards yourself, but it might also be kindness towards others. And what other random acts of kindness have you done in the last week? And what could you do given the current circumstances? So what do I stand for is about improving yourself and living closer to the values that you hold. The S in our RISE is socialise. It's pretty obvious when we put out these webinars and we get such a high interest that, and you can tell from the chat within this webinar that socialising and social connectedness is a really important part of mental health. For those of you who work in employability, I don't need to tell you that. You know that job seekers, when they're not working and they don't have that social connectedness, they are vulnerable to mental health conditions. This is the same for our family members, and I think about some of my older relatives who we've spent the last couple of weeks teaching how to use FaceTime. You know, what can we do to make sure that people in our inner circles and our social groups have those social opportunities? And it's not just about the telephone, it's also about them seeing you smile. If we're socialising more with people, we might also be spending more time in the house with people. That leads to, and can lead to, the increased chances of conflict. I've only got to spend 7 days with my husband, and I'm sure there'll be a conflict about something. So it's not about having a conflict, it's about how you deal with conflict, because conflict is completely normal, and it's completely normal to disagree with someone. So if you have other people in your house at the moment, it's completely normal to disagree. It's just about how you deal with that disagreement. So some strategies are keeping a roster for different activities that you're both doing, finding activities that you can enjoy doing together. Reminiscing about memorable moments together is a really positive way to reconnect with your partner or with your friends or your housemates that you might be living with. Sharing the good and the bad and getting support from one another, and keeping it fun and respectful when arguments happen. So socialising is a really important part of our mental health, and webinar and Zoom and all of these types of technology supports have been a fantastic way for us to continue to connect. But I encourage you to think about your circle of connection and your social circle. and work out who you haven't spoken to and why, and what we can do about it to help them to socialise and connect more. Evaluating your thinking. We also talked about this, and I might sound like a broken record, but we talked about this last week, and it's a really important element of mental health. If you understand where your emotions come from on a day-to-day basis, it is the easiest way to fix them when you know where they're coming from. We talked about this ABC model. We talked about the actual event, which is social isolation at the moment, and the particular thoughts that you might be having, like, I can't take this anymore, I'm going crazy, I can't cope with all of these changes, which might lead you to having some consequent feelings such as sadness or depression, anxiety, or feeling stressed. When we have these kind of intense feelings, we tend to have fairly negative behaviours that are linked to those, such as avoidance, becoming reactive. We also discussed last week overeating and excessive use of alcohol. So the ABC model is really important for you to moderate the feelings that you're having at the moment, and to ensure that those feelings are not overtaking the way that you behave and perform at the moment. I had a lot of feedback last week about this slide, which is a follow-up from last week, where we talked about how the different levels of stress from, I'll just try and annotate here for you. These levels of stress down here, where 0 stress to 100% stress, and this factor here looks at performance, 0 performance to 100% performance, and how if we have some stress here at 50%, we can perform the most optimal, and that's performance at work, or performance in relationships, or performance as a parent. So some level of stress is important, but not stress over 75%. And if you look back over I'll try and get back to it. If you look back over the last slide, you will have seen that the stress levels were quite high for that particular person when they thought that particular way. And so therefore, I'll try and get back now. And you can see here stress got to 75. So it's likely that the level of performance was about to drop off for that particular person based on these thoughts here. So it's not the situation that's causing the problem, it's the way that we think about the particular situation that's causing these consequent feelings. We don't need to change the social isolation. We need to change the way that we think about social isolation in order for us to manage those feelings better. So evaluating your thinking is the E in Rise Up. It's about the situation, the thoughts, the consequent feelings, and how we might dispute those particular thoughts, which will lead us to feeling a particular way. And in this example, you can see that we've started to say to ourselves, this is only temporary, which has caused us to feel less stressed and less depressed and less anxious. So evaluating your thinking and reframing it where you can. Other people don't just evaluate their thinking, they also start the morning with a mantra. So rather than waiting for a negative thought to come into your mind about social isolation, you might decide to start your morning with a particularly positive thought that really addresses any of that old negative script that's been going on in your mind. So here's some examples of some mantras that people I know are using to start their morning and start their morning in a positive frame. Some people use post-it notes to help them to get in the right frame of mind. You can put them on the fridge, you can put them anywhere around the house that gives you a reminder to stay positive. So as a bit of a summary to today's discussion, in order to, I guess, enhance our mental health during this new time, I think it's important to ensure we're in our normal routine, as normal as possible. And we may need to use tools to emphasize getting into a routine. I've given you an example and a template there that might help you. The I, which is part of RISE, is improve yourself. Let's make this an opportunity to be the best version of yourself when we are allowed to go back to work and see our peers. What can we do to improve? What would you like to do to improve? And the yes is fairly obvious. It's the opposite of social isolation. It's social connectiveness, and it's about using the technology that we have to connect with people on a face-to-face basis. And I'm asking you to make sure that any of your parents or your grandparents, if they're around, to make sure that they know how to use these types of tools. The more rippling effect we can have with teaching people to socially connect via digital mediums, the more positive it's going to be in the longer term. We will see things change forever as a result of the current circumstances, and we're already seeing that in healthcare, where video call consultations are becoming part of the norm. I've been talking about them for 2 years, but it's becoming part of the norm now, and we're seeing some relaxations around some of the more traditional industries such as health. The E is evaluating your thinking, and again, it's about making sure that the thoughts that you're having are helpful for the current situation and that they're leading you to be able to perform the best that you can in these current circumstances. So evaluate your thinking. If you were to do these 4 things this week, I think it's a great opportunity for you to rise up over the stressors that are going on today and the pressures that are going on today. We don't need to change the current circumstances. We need to change something about you, and Rise Up will help you to do that. I'm going to just take an opportunity to look at the questions, and as I do that, I will just let you know that in the coming weeks we have some other topics that are coming up just for your interest. As Scott mentioned before, he'll be sending out some links for people to register on these. But I might just turn over to Scott and see what questions we've got. The first one is, can we have a copy of the PowerPoint, which is yes. Can you tell me the website for free courses again? Yes, it's edx.org. Thank you. How do you socialise when your only socialising is work and now you are working at home where you live alone? I think that's a very good question. I would encourage you to socialise via FaceTime, via Zoom, via Messenger, via WhatsApp, anything that you can do with a video contact and a face-to-face contact. And you might be socialising with people at work, and that's okay. But if there are other people outside of work that you might normally be socialising with, a sporting group or somebody else, then I'm encouraging you to access those people via those same mediums as well, and to make sure that you make time for those. No other questions at this point. Scott, is that any questions on the chat?
No, we're just having a really good conversation going through, people feeding back really good, great comments. I think the website you've shared is really interesting for people, so thanks for that. No, back to you.
Great, and it looks like people are also adding in some new ideas about how to socialise, which is fantastic. The house party app sounds like a great idea. I think it's a really good opportunity for us to try all these new things and have a go at these new things if you haven't already. If we restrain ourselves during this time and we only think about the things that we can't do at the moment, and the grief of losing our normal way of living, then we won't try these new things. So it's a great time to try. So guys, that's about all for me. This is a quick tip on making sure that you're healthy and accessing all the resources that you have at your fingertips right now to be as well as you can, because I know when you're well that all of the clients that you work with will have the best opportunity, and together we'll have the best opportunity to address the 1 in 4 people that will have a mental health condition moving forward. And if that's worse, we need everybody's help to make sure that that number goes down. So thanks everyone. Look forward to joining me next week. Have a great day.
Thanks, Kylie. Thanks everyone from the Better Health Generation. That was absolutely amazing again. Thank you for everyone that joined us today. Please remember the video will be uploaded to the IP YouTube channel later on today. Share it as widely as you can. It's really important that people get these tips. And thanks very much once again to you guys from the Better Health Generation all the way over there on the other side of the world. It's evening time over there, so thanks very much, Kylie. That was amazing. If I could be there, I would be there in the UK. Unfortunately, we're not flying. Bye, guys. Bye-bye.